Hello, I'm Dr. Clint Sexton with Naperville Integrated Wellness, and today I want to talk about your thyroid tests. So many times doctors will run just a couple basic tests on the thyroid, and we're going to talk about 3 of those main tests and how those can be influenced by other factors other than just what's going on with the thyroid itself. So let's start with the most common one, which is called a TSH. And that's a thyroid stimulating hormone. So that's a hormone that's coming from your pituitary gland, which is in your head. That TSH goes to your thyroid gland, and it tells the thyroid gland to make a hormone. Okay, and that hormone is called T4. After that T4 hormone is made, it's released out into the body, and it goes back up to the pituitary gland. It also goes out to other organs like the liver and the kidney and the gut itself, where it gets turned into the active form of thyroid hormone, which is called T3. So we're going to talk about those 3 main hormones, TSH, T4, and T3. So first, let's see what can happen at the level of the pituitary gland. So let's say your thyroid is making that T4 hormone, or maybe you're taking T4 hormone as a medication. That's going to go up to the pituitary gland, where within that gland it gets turned into the active hormone, which is T3. So when you're measuring your hormone levels of T3 in the blood, that's not telling us what the T3 levels are in the pituitary itself. Okay, so many things can influence how your pituitary gland is going to turn T4 into the active hormone T3. And that involves a special type of enzyme. And we call these deiodinase enzymes. And we have 3 kinds. So the kind that works in the pituitary gland is called D2. And this enzyme is going to be affected by other factors in the body, such as if you're stressed or you're not sleeping well, or if you have inflammation, or if you have other immune system problems going on, nutrient deficiencies. There's many things that are going to influence how your pituitary is going to take that thyroid hormone and turn it into TSH. Turn it into T3. And then that's going to determine how much TSH your pituitary gland is releasing out into the bloodstream, which is measured in the test. So the point I want to get is that those other variables like stress, inflammation, other factors with the immune system, just being fatigued, even infections or nutrient deficiencies are going to alter your TSH level, and it's not going to really give you a really good indicator of what's going on with your levels of your T4 or T3 hormone, which is why the test is being run by your doctor. Okay, so now let's talk about another enzyme system. So we have another one, and this one's called D1, and again, it's another one of these deiodinase enzymes. And the reason we call that is what they're doing is they're taking an iodine off of the T4 and turning it into T3. So it's a deiodinase, right? De-iodining type of enzyme. But again, the key point here is that the enzyme in the pituitary gland, this is D2, and it's a different enzyme system than the one that converts the T4 that goes out into your body and turning that into T3. That's a D1 enzyme. Okay, so 2 different enzymes, and so both of these are different enzymes. One's going to affect your TSH differently, one's going to affect your levels of T3 differently that you're measuring in the blood. Okay, we also then have another one of these type of enzymes, and we'll call it D3. Now what this does is this takes your T4 hormone and turns it into another type of T3. We'll call it reverse T3, but this reverse or RT3 does not helping you biologically. It essentially is going to get in the way of your active T3. Okay, so I know this gets a little complicated, so for more details on how all this works, you should check out the blog. But the point I'm trying to make is you have 3 different enzyme systems that are going to behave differently based on different factors going on within your body, and these are not related to just the thyroid itself. Okay, these are going back to inflammation, the immune system, infection, nutrient deficiencies, etc. So this is why it can be a little challenging when you're getting your thyroid test and going, well, is you look at it and the TSH can be low many times, and that doesn't mean that you're making a lot of thyroid hormone. It can be low because you're under more stress, and so the enzyme in the pituitary is behaving differently. Or your T4 levels look okay, but when they measure the T3 in the blood, those look lower, again, because that's affecting the other enzyme, okay, that one we call D1, which is functioning in the liver and the kidney and the gut, etc. So the point I'm trying to make here again is that things that are going on in your body, they're going to influence how these enzyme systems work. These are going to influence your TSH levels. They're going to influence your T4 levels. They're going to influence your T3 levels, okay? And if that happens, it starts affecting other thyroid tests. that that were run, like a free T4 or a free T3, and that one we called reverse T3. So there's many different types of tests for the thyroid, but hopefully this just gives you a little more insight into maybe something's being missed with this. And one more point I want to make is that if you have an autoimmune issue with the thyroid, like Hashimoto's disease, when you have flares of the condition itself, flares of the immune system, and you have damage to the thyroid, that's going to cause your TSH to go up and down, cause your T4 and T3 to go up and down. And so you have to consider these factors as well when, again, you're looking at the levels of thyroid hormone. Okay, so hopefully this give you something else to consider when looking at your thyroid tests, and maybe there is something that's being missed with this. Hope you found this helpful. Thank you.